In today's video, we're going to be talking about deprescribing. And if you're someone that's been thinking about coming off of their psychotropic medication, then this video is for you, because I'm going to summarize what deprescribing is, when you should consider deprescribing, and how to safely deprescribe. So stay tuned. So number one, what is deprescribing? Well, deprescribing is the process of safely coming off of or reducing your doses of medications that may be causing harm or may no longer be of benefit to you. And how this applies to psychiatry is that many patients get stuck on multiple medications and oftentimes are experiencing lots of side effects, but instead of looking at them as side effects, they're looked at this condition themselves, like say depression or anxiety, becoming worse. And so more medications are added to the mix, and then the next thing you know, the person is on multiple medications and not feeling any better. And oftentimes patients will also get labeled treatment resistant as well. And so deprescribing is just all about just safely reducing those medications or helping to eliminate them altogether. And so number two, when should you deprescribe? Well, if you're taking more than 5 medications and you're not feeling well, then you should probably consider deprescribing, because you're probably experiencing some drug interactions and even some side effects. Also, if you've been on an antidepressant for more than 6 months and you're feeling stable, then have a conversation with your psychiatrist about safely coming off of that medication, because clinical guidelines state that antidepressants really should be used short-term, like 6 months to a year max, to help the patient during that time, since depression is really considered to be a self-limiting condition. And so if you're feeling better and stable on that antidepressant, just have that conversation with your provider about how to safely come off, so that way you don't end up being stuck on the medication or end up down that path of being on 5 or more medications and getting the label of treatment resistant. Now, the same thing applies to the anxiolytic medications, and specifically the benzodiazepines. And as you all know, I have a couple of videos out on those benzodiazepines, and there are a lot of ugly truths about the benzodiazepines that aren't really discussed in mainstream or conventional medicine. So if you missed that video, I advise for you to check it out right here. So in any rate, when you're on an anxiolytic medication, you should really only be on it for 2 to 4 weeks max. And that's just to help you through a time until you can get into therapy to work on the anxiety and even say panic attacks. So that way you can use skills to get you off the pills and use skills to help reduce your anxiety. Because anxiety medications like the benzodiazepines, when taken long-term, have a lot of deleterious side effects as well as long-term effects. So they cause damage for most people in the long run. Taking them long-term consistently can develop dependence, tolerance, and then a phenomenon of withdrawal and even bind, which is benzo-induced neurological dysfunction. And then another thing to consider with these benzos is that if you're taking them for more than 2 weeks, so say you've been on them for months or even years, and now you're not getting any benefit from them, which could actually be when you're in this state of tolerance and dependence or bind or even rebound anxiety, then you should probably consider coming off of them, because they're probably doing more harm than good. And so number 3, how do I deprescribe? Well, first, it should be done under the direction of a provider. So you want to find a provider who can work with you on slowly tapering your medication. Now, it's going to be best to use the provider that prescribed it to you in the first place. And there's actually a guide on how to speak with your provider that I'll link to down below to help you through this process. But if your provider is not able or willing to help you with deprescribing, then you're going to want to look for a prescriber who knows how to deprescribe safely. But it definitely should be done under the direction of your provider, because that way it can be done in a safe manner. Because done correctly, deprescribing is a very slow process. So it's important to understand that deprescribing can take months and oftentimes years, depending on how long you've been on your psychotropic medications and also which kinds of psychotropic medications you're on. And so keep that in mind. It should also be patient-led, meaning that you, the patient, should be guiding the provider in when you're ready to take the next step based off of your symptoms. And I'll be talking about some specific deprescribing tips that actually help you to evaluate, like, when do I know when it's time to move on the next stage in the next video. So make sure you're subscribed so you don't miss out on that. But just know that it's a slow process and should be patient-led. Also, before even embarking on deprescribing, I believe it's very important that you look for root causes of your symptoms. So what could be some of those root causes of your depression and anxiety? Was it childhood trauma? Was it the way you're thinking about things at work? Was it stress? Could it be an underlying deficiency? Or could it be something like hyper or hypothyroidism? I talk about these things in Why Antidepressants Don't Work, so if you missed that video, check it out. But I really believe that it's important to look for any underlying root causes and start working on resolving those before you deprescribe, so that way when you do come off of your medication, you actually have some tools and some skills and perhaps some lifestyle changes that help support your overall mental health and physical health. Now that wraps up the summary of deprescribing. However, if you want to dive a little bit deeper, you may want to consider getting the book on Deprescribing Guidelines. This is the Maudsley Deprescribing Guidelines by Dr. Mark Horowitz and Dr. David Taylor. This book will actually help walk you through step by step the process of deprescribing, as well as has many guidelines and charts and deprescribing steps and stages for hyperbolic tapers for just about every antidepressant, every benzodiazepine, and even the gabapentin and Z drugs or hypnotics. Now, I also covered a little bit deeper on the topic of this book and deprescribing in my members live. So if that's something you'd be interested in, for $4.99, you can go and look at that recording and then have direct access to me by messaging in the comments section, and I can answer your direct questions and also have another live that answers your specific question. So that's more of me on a one to small group setting. As right now we only have 4 members, but when we get to 10 members, I'd like to start doing a Zoom call so that way we can have more interaction and you can ask your questions to me face to face. Anyhow, if that interests you, go ahead and check the link down in the description on how to join to become a member. So that wraps up the video on deprescribing. Have you had any experience coming off of your psychotropic medications, or does this topic interest you? Let us know down in the comment section below, because we learn from sharing each other's experiences. And as always, I thank you all for watching. I wish you well on your mental health care journey, and I look forward to seeing you all next week.